What do doctors really think about the elderly? This is a question that many elderly people, as well as their relatives, often ponder. Behind the words of encouragement and the kind smiles in the clinic, do doctors have their own perspectives, hidden truths that have never been spoken? Let's delve into the 10 segments below to discover 5 harsh truths that every elderly person should know, and listen to the genuine thoughts from the doctors. The truth about listening to elderly patients. Many elderly people often complain that doctors do not listen to them long enough or feel that the symptoms they describe are taken lightly. The truth is, with time pressure and a large number of patients, doctors often have to prioritize the most important information. Doctors still want to understand you, but in reality, they have to filter out what is most essential for diagnosis. Sometimes, long stories and vague pains make it difficult for doctors to focus on the main issue. This does not mean they lack concern, but that they have to balance empathy with professional duties. Elderly people are often prioritized or considered too old to be treated. Elderly people and the issue of treatment adherence. Doctors often find that elderly people forget to take their medication, do not follow dietary regimes, or do not adhere to advice about physical activity. Sometimes doctors feel powerless in the face of stubbornness or lack of cooperation from older patients. Occasionally, generational differences and varying levels of medical knowledge make communication between the two parties difficult. Doctors want you to be more proactive, but also understand that old age comes with poor memory, reduced mobility, and sometimes loneliness and depression. Fatigue in the treatment of chronic illness in the elderly. Doctors treating elderly patients often have to face a long list of chronic diseases: hypertension, diabetes, osteoporosis, heart disease, osteoarthritis. Managing multiple medications, handling side effects, and monitoring disease progression is a real challenge. Doctors must both care for overall health and pay attention to the patient's quality of life. Sometimes they feel exhausted from constantly adjusting medications without significant improvement in the illness. Elderly people are often considered difficult or complain a lot. Some doctors admit that they feel pressured when they have to repeatedly explain things to elderly patients or face complaints about services, medication, or staff attitudes. Although they know that old age comes with sensitivity, doctors are also human and sometimes feel uncomfortable or tired. However, most try to remain patient because they understand that the elderly need to be shared with and empathized with. The truth about the expectations of older adults towards doctors. Many elderly people come for medical examinations hoping that the doctor will completely cure all their illnesses. They wait for a miracle from medicine. But doctors understand the limits of treatment, especially when age has affected the ability to recover. The harsh truth is that some diseases cannot be cured, only managed. And doctors want patients and their families to understand this. Understanding helps both sides cooperate better and avoid unnecessary disappointment. Loneliness and the need for spiritual care. The doctor realized that many elderly people come to the clinic not only because of illness, but also because of loneliness. They need a place to talk and share their feelings. Sometimes the doctor just listens and encourages them, understanding that mental health is just as important as physical health. However, with a large number of patients, the doctor cannot spend too much time with each person. That is why doctors hope to have more social workers and psychological counselors to better support the elderly. Elderly people and the fear of death. Doctors often witness the fear of loss and death in elderly patients. Many elderly people ask doctors about the signs of serious illness and their chances of survival. Doctors understand that, beyond treatment, they must also help patients prepare psychologically, helping them find peace when facing old age and death. This is an important part of geriatric medicine, but it is also a significant challenge for young doctors who lack experience. Elderly people and doctors' assessment of quality of life. Doctors not only focus on sustaining life, but also emphasize improving the quality of life for the elderly. They weigh the benefits of aggressive treatment against the risk of complications, balancing life extension with ensuring mental and social well-being. Sometimes, doctors prioritize gentle, pain-relieving solutions rather than aggressive interventions. This stems from respecting the patient's wishes and the desire to provide them with the most meaningful final days. The truth about the relationship between doctors and the elderly. Finally, the doctors all admit that working with the elderly is a special experience. They learn patience, empathy, and realize the value of every moment of life. Although there are times of fatigue and pressure, most doctors feel grateful to be able to care for the elderly. They hope to be trusted and cooperated with by the elderly, and also hope that society will pay more attention to this age group. We have gone through 10 segments with 5 harsh truths that every elderly person should know from a doctor's perspective. Behind the white lab coats are emotions, challenges, and also good hopes for the elderly. Hopefully, by understanding these truths, the elderly and doctors will accompany each other on the journey of healthcare with mutual understanding and respect. These 5 facts may shock you, but knowing them early means there is still time to change. Be honest with your doctor, follow treatment, take care of your mental health, and cultivate a healthy lifestyle. Old age does not mean giving up. It is an opportunity to live slowly, live healthily, and live happier. Elderly people are a special group in healthcare, not only because of physical challenges, but also due to psychological, social, and spiritual factors associated with aging. As age increases, the human body undergoes many complex changes: weakened immune system, increased prevalence of chronic diseases, decreased organ function, leading to vulnerability to medical complications. Additionally, the elderly often face mental losses such as the passing of friends and relatives, changes in social roles after retirement, reduced social interactions, leading to risks of loneliness and depression. For doctors, caring for elderly patients requires understanding, patience, and special skills. Consultation time is often limited due to work pressure and a large number of patients, while communication with the elderly is more complex due to memory decline, hearing impairment, or psychological barriers. Therefore, doctors must prioritize important information when communicating to avoid overwhelming or confusing patients. This is both an art and a science, as every decision must balance treatment benefits and the quality of life of the elderly. One of the biggest challenges doctors face is choosing between aggressive treatment and palliative care. When elderly patients have chronic diseases such as cancer, diabetes, heart failure, or kidney failure, doctors must consider whether continuing intensive treatment regimens truly improves lifespan or only prolongs pain and inconvenience for the patient. Many elderly people wish to live healthily without enduring side effects from medications or invasive procedures. Therefore, doctors need to listen to patients' opinions and wishes, discuss with families to find appropriate directions that ensure both physical and mental well-being for the elderly. However, in reality, not all patients are willing to cooperate or comply with treatment. Many older adults tend to deny illness or forget to take medication due to memory decline, or fail to follow nutritional and exercise recommendations. Others may worry excessively or continuously complain, causing doctors to feel tired and pressured. That is why building a trusting, empathetic relationship between doctors and patients is important, creating a positive environment for the elderly to share and cooperate in healthcare. Besides treating diseases, doctors also have the responsibility to support the spirit, helping elderly patients prepare psychologically to face aging and death. This is a sensitive topic often avoided in Vietnamese culture, but is very necessary for the elderly to feel secure and live fully each remaining day. Doctors need to skillfully initiate and share about the meaning of life, how to accept natural laws, while encouraging patients to participate in social activities and maintain personal interests to preserve mental health. During treatment, doctors also face fatigue and stress from caring for chronic patients over long periods. Difficult cases, slow disease progression, along with continuous complaints from the elderly, sometimes make doctors feel pressured and even lose motivation. To overcome this, doctors need to maintain a balance between work and life, Learn to empathize and share with patients, and recognize the value of their profession. Elderly individuals themselves should actively cooperate with doctors, honestly share their health status, comply with treatment regimens, and maintain a healthy lifestyle. Balanced nutrition, moderate exercise, optimistic spirit, and community participation. Families also play an important role in encouraging and supporting the elderly psychologically and materially, creating the best conditions for them to live healthily and happily. Medically, elderly care today goes beyond treating diseases to include comprehensive support services, physical therapy, rehabilitation, nutritional counseling, psychological care, and health education. Home-based chronic disease management programs and remote monitoring technologies are increasingly popular, helping reduce the burden on the healthcare system and improve the quality of life for the elderly. Moreover, emphasis should be placed on disease prevention and early detection of health problems in the elderly. Regular health checkups, full vaccinations, and screening tests for cancer, cardiovascular diseases, diabetes, osteoporosis, etc., help detect and control diseases more effectively. Doctors should guide patients and families on recognizing abnormal signs and encourage them to seek medical attention promptly when suspicious symptoms arise. Another important factor is end-of-life care, also known as palliative care. When elderly patients enter the final stage of illness, treatment goals shift from prolonging life to pain relief, improving quality of life, providing psychological support, and preparing both patients and families mentally. Doctors need to closely coordinate with psychologists, social workers, and nurses to develop comprehensive care plans, ensuring the elderly pass away peacefully, without pain or anxiety. In modern society, average life expectancy is increasing, meaning the number of elderly people is also growing. This poses a major challenge for the healthcare sector, requiring training of doctors and nurses specialized in geriatrics and developing care models suitable for the characteristics of the elderly. Additionally, raising community awareness about the role of elderly care and encouraging family and social participation in supporting healthy and meaningful lives for the elderly are necessary. The role of doctors in elderly care is not only as healers, but also as companions who listen, share, and encourage. They need to understand patients' circumstances and wishes, respect the elderly's choices, and provide full information so that patients and families can make appropriate decisions about treatment and care. This helps strengthen trust and cooperation between both sides, creating a solid foundation for healthcare. Doctors should also update their knowledge in geriatrics, communication skills, and psychology to best meet the needs of the elderly. Regular participation in training courses, specialized seminars, and experience exchange with colleagues domestically and internationally helps improve professional capacity and provide better service quality to patients. Furthermore, health policies need to pay more attention to the elderly, developing suitable health insurance programs, supporting treatment costs, and expanding community care services, nursing homes, and rehabilitation centers. Coordination among hospitals, clinics, social organizations, and families helps form a comprehensive care network that meets the diverse needs of the elderly. For elderly individuals, maintaining health depends not only on doctors, but also on self-care awareness, proactive disease prevention, and maintaining healthy habits. Balanced nutrition, regular exercise, weight control, avoiding risk factors such as smoking and alcohol abuse, while keeping an optimistic spirit and participating in social and lifelong learning activities, help the elderly live happily, healthily, prolong lifespan, and improve quality of life. Families and relatives also need to care for, encourage, and support the elderly both psychologically and materially. Regular visits, listening, sharing, and participating in recreational activities, entertainment, and travel help the elderly feel loved and valued. When the elderly are seriously ill, families should closely coordinate with doctors and nurses to develop appropriate care plans, ensuring the best support during their final days. Caring for the elderly is a responsibility of the whole society, not just the healthcare sector or families. Community organizations, associations, and government agencies need to develop healthcare programs and provide material and spiritual support for the elderly, helping them integrate and contribute to the country's development. Creating a safe, friendly, and convenient living environment for the elderly also contributes to improving the quality of life for the entire society. In the process of elderly healthcare, doctors may face many challenges: uncooperative patients, lack of family support, limitations in the healthcare system, high treatment costs, and lack of specialized support services. However, with love for the profession, empathy, patience, and professional knowledge, doctors can still bring great value to the elderly, helping them live healthily, happily, and confidently face aging and death. The most important thing is to build a trusting, cooperative relationship between doctors, patients, and families. With consensus and sharing, all decisions about treatment and care become easier and more effective. The elderly will feel secure, comfortable, less anxious, and cooperate well in the recovery process. The healthcare sector needs to continue investing in and developing modern geriatric services, training highly specialized experts, and strengthening interdisciplinary coordination. Medicine, psychology, sociology, physical therapy, and rehabilitation. Establishing elderly care centers, nursing homes, and specialized clinics helps meet the increasing social demand and improve the quality of life for the elderly. Doctors also need to focus on professional ethics, respect the autonomy of elderly patients, and protect their rights during treatment and care. Listening, sharing, respecting personal opinions, and providing complete medical information and thorough counseling help the elderly and their families make appropriate decisions, ensuring optimal rights and quality of life. Elderly people, with their life experience, wisdom, and emotions, can still contribute to social development. Caring for and respecting the elderly is not only the responsibility of the healthcare sector, but also a cultural and traditional virtue of the Vietnamese people. We will all grow old someday, so let us together build a safe, friendly, and loving environment for the elderly, helping them live fully, meaningfully, and happily. In summary, elderly health care is a long-term process requiring close cooperation among doctors, patients, families, and society. Doctors need to understand the psychology and circumstances of the elderly, balance aggressive treatment and palliative care, and focus on improving patients' quality of life. The elderly should actively cooperate, comply with treatment, maintain healthy lifestyles, and keep an optimistic spirit. Families and society need to support, encourage, and create the best conditions for the elderly to live healthily and happily. Understanding these truths helps the elderly and doctors better accompany each other in healthcare, encouraging elderly people to be honest, comply with treatment, and maintain healthy lifestyles to live healthier and happier lives. Everyone, doctors, patients, or relatives, plays an important role in the journey of elderly care, contributing to building a humane, progressive, and happy society.